once again, I'm extremely grateful to your page, whatever work you are doing. It's I don't know if you realize it or not, but every small thing you post, every small comment you make has the power to transform someone's career. Something might click with somebody, and so just I'm very happy you gave me the opportunity to share my experience.
Okay.
Yes, so I did my med school from Gujarat University.
Very nice.
In India.
Fantastic. And when did you graduate?
So I graduated from my medical school in 2009, following which I accepted a residency training position in community medicine. And
in
I
India
finished
itself.
that. Yes, so I finished my residency training in 2012.
Okay, fantastic. So you finished in 2012, and then when did you then decide, okay, I want to go to the US and do psychiatry?
So it was in my second year. So I was always inclined towards mental health, but I always was confused between public mental health and psychiatry.
Okay.
So I ended up choosing community medicine because that was one field which I believe I could make a good impact in the mental health of the community as a whole. And during my residency training, I got inspired to come to US. So after finishing my training, I worked for a few years, and then I applied for a master's program in public health at Johns Hopkins. The reason I was inspired to apply to this program is because this is the only school of public health which had their own department of mental health. So I kind of intuitively felt that I want to learn more, but I was not happy with the conventional methodology. I would always think on how I could make an impact on a bigger population. So that motivated me to build a foundation in public mental health, and this was a very good platform for me. I graduated from my MPH in 2016, during which I finished my steps alongside my residency and my master's. Then I got an experience for a couple of years in pharmaceutical research, where I was part of the team that developed the first FDA-approved treatment for pheochromocytoma. And then I got some clinical experience in the form of externships and observerships. I gave my step 3, and this last year I applied for my first match, and I was very fortunate that I got accepted.
Very nice. Fantastic.
So it's been a long journey. I'm so sorry.
Oh no, that's perfect.
It's been a pretty long journey.
No, that's very helpful to know because you know, the kind of path that you took, it's kind of something that we don't get to hear often. And you know, the path that you took, like going through MPH and especially you know, dealing with mental health. So that's very, I've never heard of that. So that's very unique in my opinion.
Right. I always went with the flow. I never had a fixed thing in my mind that this is how my path should be. Whatever appealed to me at the moment and whatever inspired me to learn more helped me make my decisions. So I just went with the flow.
Very nice.
But I do agree that it is an unconventional path now that I look back at it.
I hear you. No, well, I mean, sometimes these unconventional paths is what gets, you know, programs very excited and very interested. So, so I'm glad you did this. Now, you finished in 2016. It was like a 1-year MPH. Is that right?
Right. So most of the MPH programs have a 2 years duration. However, there are a few programs which have accelerated track.
Yes.
And if you have a prior public health experience, then it is easy for you to get accepted into those tracks. And so I was like, yeah, if I can get done in 1 year, why not? And for me to get accepted from a university like Johns Hopkins and to study in the first department of mental health in the world was a very inspiring factor.
Amazing. So now when you were doing the MPH, were you also involved in any kind of like clinical research? Was that also needed while you were there?
So during my master's program, I used to get a lot of free time because and we had a department of psychiatry in this next building to the School of Public Health. And they were very encouraging to, they give a lot of encouragement and resources to how do I say, support your research initiatives. So yes, I was involved in research in psychiatry, but it was not core clinical research. Uh, I had the opportunity to combine my skills of data analysis and medical background to study the biomarkers and their roles in schizophrenia.
Very nice. Amazing. So with that educational qualifications, you then went into pharmaceutical research. Is that right?
So pharmaceutical research just happened. Like I said, I never had a very structured path. So my major in MPH was biostatistics and mental health epidemiology.
Amazing.
So after graduating, I was looking for opportunities to continue my experience in the United States. As a foreign student, you have 1 year of work authorization, after which you have to go back,
yes,
unless you can secure a work visa. So there were very few opportunities available to me at that time, which gave me the opportunity to get a visa sponsorship.
Mm-hmm, mm-hmm.
So pharmaceutical research was one such place which offered to do my immigration paperwork, and also gave me the opportunity to apply the skills that I had learned in data analysis and biostatistics to perform something meaningful. But most importantly, the project that was happening was they were developing the first FDA-approved therapy for pheochromocytoma. So I thought if I could be a part of the team that does that, I would feel very fortunate to have done something meaningful at the end of the day. So yes, it wasn't core psychiatry or mental health, but it was something that I found very inspiring, and I just went with it.
So now when, so it was after that pharmaceutical research, was it at that time you thought, okay, I think I should now go into psychiatry residency training?
So even during my pharmaceutical research and my MPH, I was always connected with psychiatry in one form or another.
Very nice.
I used to work 9 to 5 in the mornings, and after 5 p.m. I would go volunteer with a psychiatrist at New York City. It was after I got my immigration paperwork completed that I had the flexibility to leave my job and pursue externships and observerships.
Very nice. Yeah.
So it was again a very gradual process. It started in 2016, and over the next 3 years,
mm-hmm.
I gained meaningful research and clinical experience in psychiatry.
Okay.
And by the time I gave my step 3, I was like, okay, now is a good time to apply for the match. And I did apply, and it worked out.
Amazing. So of course you then, you took your steps, you did a step 3 like you said. You want to comment about your scores, below average, above average, excellent? How would you say your scores were?
So I had step 1, I had 217 in step 1, and I had 230 in step 2 CK. Then I had 207 in step 3, yep, and a CS all in first attempt.
Fantastic.
I wouldn't say if it's a good score, average, or a good score, because it's all very relative. Absolutely. But at the end of the day, I never put myself, I had this one insight that if I start comparing myself with others, it might hamper my productivity or my enthusiasm. So I would just compare myself with my own self, like how I was doing in my previous step. Am I performing better? Am I working harder than I used to work? And I just looked ahead. I didn't look left or right.
Very nice. Very nice. Tell me about the U.S. clinical experience. So you said you did some externships and observerships. Is that right?
Right. So one of the good things of being on the East Coast is there are ample opportunities to get involved in observerships as well as externships. Okay. So by the time I applied for the match, I had 9 to 11 months of core clinical experience in the form of observership and externships. The reason I went for it because I wasn't a fresh graduate, so I knew the program would want to look at my clinical profile. And I thought it would be best if I could devote at least a year, if not more, to get some solid foundation in psychiatry.
Yeah, yeah. So now these let's talk about the observerships and externships. Firstly, how did you find these positions?
So fortunately, the social media has been a very useful resource for me. So as a rule, I would reach out to everybody. If I knew that somebody is a psychiatrist or is applying for psychiatry, I would just connect with them and I would inquire about opportunities. So it was more like pooling in information from multiple sources. And every person I interacted with gave me something helpful. And I just synthesized and I thought whatever worked best for me geographically, financially, I just went with it. So my friends and my co-applicants were my strongest resource. And of course, there were like Facebook forums and people like you who were always available at every step to guide me further.
Fantastic, yeah. And the externship, so certainly that means it's more hands-on. Was that also in psychiatry?
Yes. So all my research, all my clinical experience, I always knew that this was something I want to do, psychiatry. A lot of my mentors and friends did suggest that why don't you get experience in 2 fields, have something as a backup. But that was an idea which never appealed to me personally. So whatever I did was in psychiatry.
I hear you. And then, so you got your, and then I'm sure that's where you got all your letters of recommendation from people you did your externship and observership with.
Yes, yes. So I had, when I applied for the match, we have to submit 4 letters of recommendation.
Absolutely.
3 minimum, but 4 is an ideal number. I had 3 letters from psychiatrists, and I used 1 letter from my pharmaceutical research.
Yes.
It was a very unconventional choice. People not always put letters from people who are not in psychiatry. My writer was a PhD in epidemiology. I'm so sorry, she was a DRPH. But I wanted the letter to reflect the work I had done for research. I had spent 1.5 years analyzing the data and supporting the whole process of the FDA approval. And that is something I'm still very proud of. So I wanted that to be a part of my application. I did not analyze whether it would work for me or it would not work for me, but that is something that appealed to me, and I intuitively went with it.
Yeah, yeah. Now, these observerships and externships, were they in like university hospitals or private clinics or kind of a mix of both?
Overall, they were a mix of everything. I had some clinical experience from Johns Hopkins, some research experience from Johns Hopkins. Then whatever opportunity came my way, I took it. I didn't analyze whether it's a university, it's a community. But yes, if you get an experience from a university program, that always have a very high weightage. But again, at the end of the day, the content of your letter matters more in my perspective than the institute.
Exactly. And then the content of the letter will come from the kind of work that you do. So for example, there's a lot of discussion about should I take an observership in a university hospital versus an externship in say a private clinic. And you have any thoughts about that?
I honestly am not a very good person to answer this question because I never analyzed it a lot.
Okay.
Now that you have asked me, in my personal opinion, an externship would hold a higher weightage than an observership, unless you're doing an observership from under such a person who is very renowned in the field of psychiatry and whose letter would put a lot of weight on your CV.
Exactly.
So again, there is no one shoe fits all approach. You have to see what is in front of you and then make the best call. But again, I agree. I wish I could do more justice to this question, but this is my perception.
That's amazing. No, that's very true because yes, sometimes, even now the university hospitals, like for example, again, it all depends on the attending who's going to end up writing the letter. And if that attending, if he or she is someone, not very well known and you didn't really get to do a lot in that observership because you can't, put notes, you can't like examine patients and everything, then I mean, the letter is going to look weak unless, you did a lot of like presentations or something. How did you make the most of your time in an observership besides, shadowing the doctors? Is there anything else that you did to grab their attention, to get a stronger letter?
So I always believed in being natural. I believe that the person, my attending or my mentor, he is a psychiatrist. I mean, if I try to be something I'm not, if I do something to grab his attention, it might go against me.
Mm-hmm.
But I was always very sincere. I was always very upfront, and I would always tell them that I really want to be a psychiatrist. And if there is anything I could do to support the team work, if there's any project you might need help with, these are my particular skill set. And again, I would just put myself out.
Yeah.
And I would communicate in a very clear and honest way. And I feel that has always worked for me. Yes, it does help if you actively request the attending that if you could present a case. It does help if you reach out to the resident and tell them, hey, if you need any help with any research project, basically whatever is required at that moment. It could even be helping the nurse or the janitor open the door, or it could be helping the program director publish his next manuscript. Most importantly, I believe it is that we should have an attitude of being available for whatever is needed at that moment. And if we have sincerity in our intentions, it will reflect, and it will definitely go a long way in whatever we expect from the rotation, if it's a letter, if it's an experience, or whatever.
So now we're in June, end of June, and a lot of discussions are now happening about getting the letters of support. Do you want to share how you approached your attendings to get a letter of support? For example, some strategies would be letting them know right at the beginning of that 1 month, say, observership, or let them know after you leave or just before you're leaving. What has been your experience, in reaching out to these attendings?
Yeah, so I had the same question when I started my first rotation. And again, like I would ask my fellow medical students who had more experience. I would ask the program administrator that, and the common answer which I got from most of the resources is, don't ask for letters on day one. See, they know that you want to be a psychiatrist. That's why you are putting your money and time to do the rotation. They know that the reason you're putting this effort is because at the end of the day, you will expect a letter. But I wouldn't think it goes in your favor to just go and say that on the first day. I would say just wait for a few days into your rotation. Just show your sincerity, just show your personality. Yes. And more often than not, they actively ask you, okay, what do you want to do? And you can always tell them that I'm very inspired to be a psychiatrist. Yes. And at the end of the rotation, you can tell them that I had a wonderful experience working here. I will be applying for my residency in September, and it would be very helpful for me if I could get a letter. So again, just be honest, just be upfront. Don't be wishy-washy. Don't be manipulative. Honesty is the best policy. That is what I would say. And again, wait till the end of the rotation. Don't go on day one.
I hear you. Yeah. Now, I think that's a very good approach because, yeah, some you need to be, of course, upfront with them. You can't be like writing to them like 1 month after the rotation's over that, hey, could you write me a letter? But at the same, so it shouldn't be too late nor too early. What you're doing is kind of just the right time. That is kind of maybe in the last week when you're kind of just about to, move on to kind of finish the rotation and move on. That might be a very good time to personally approach that attending and say, hey, could you write me a strong letter of support for my for my psychiatry application?
Right. Just to add to it briefly, let's say if you have a 2 weeks rotation, then it's a very short period. Then it makes sense to ask them at the end of the first week or the beginning of the second week. If you have a 3 month rotation, then I would say after 1 month or 2 months would be an ideal time. Never interrupt them during their work to ask for a letter. Yes. Always tell them, hey, Dr. XYZ, would you have 2 minutes to talk to me? I would like to talk. Can I have 2 minutes of your time?
Yeah.
And then they will actually tell you, yeah, why don't you come back to me after the rounds are over? And then you can tell them what your intentions are. But again, asking at the right time is also important.
Absolutely. All right, so you got your letters. So, a lot of good things that we have discussed so far on how you built your application, starting with, your MPH research, pharmaceutical research, US clinical experience. For psychiatry, is there anything else that you might have heard about people trying to strengthen their application?
Yes. So unanimously, I used to hear two things. Number one is step 3.
Okay.
Everybody would emphasize a lot on how important step 3 is for your application. So I made sure that I gave my step 3. I had my step 3 score before I applied, especially considering the fact that I'm a foreign medical graduate who has spent a few years after completing his med school.
Okay.
And secondly, continued experience. So psychiatry is one field where they really love to see that are you committed to the field?
Yes.
Maybe because they have realized that psychiatry, although people might think that it's easy, but it is not. And in the past, I believe people would look at psychiatry as a backup option. They would be applying to other branch. I'm not saying this is wrong, but this is what was maybe the trend in the past. So to rule these two things out, they want to make sure that you have been showing continued interest in psychiatry in one form or another. It could be observership, it could be research, it could be volunteering at a clinic, but that is one thing they like to see.
I hear you. Because, for medicine, like, there was like a video that I just put out where, that doctor who matched into residency, so he kind of did like all this like point of care ultrasound, which goes for internal medicine, or some, these online courses. So I was kind of asked, anything for psychiatry, is there anything else beyond that you might have come across? But it seems like the observerships and the externships and the research, that's and the commitment, I think, that's kind of, and the step 3, like you mentioned, is
right. I'm sure there are. Everybody's approach is unique. Everybody is brilliant in their approach, but this is what I based my approach on, and I think this is a very safe approach. But again, I'm sure there are other interesting, innovative methods by which people approach this specialty.
Very nice. Personal statement. So when did you start writing that?
So to be very honest with you, I feel I should have worked harder on my personal statement. So for me, everything happened in a very short span of time. My USMLEs, my clinical experience, I was wearing a lot of hats at the same time. So I started, I would say 2 months or 6 weeks in advance, but I would say ideally it is best to start at least 2 to 3 months in advance. And we all know the reasons why. It's not simple, it takes time, there is a lot of revision. You have to have multiple feedbacks from different perspectives.
Okay. When you wrote your personal statement, do you want to share anything that you feel made your personal statement stand out? Fantastic. So now we're into September, and you're applying to programs. Do you mind sharing how many programs you applied to?
I applied widely.
Okay.
I believe in taking all the chances, knocking at all the doors. So I would go on the website of the program, and my only filter, if the program had taken any foreign medical graduates in the past, I would apply to that program. There were a few programs which I believe I should not put my money in, because I did not see any foreign graduate for last 5 years.
Okay.
And I had no personal connection in those programs, and I had no geographical ties, so I just left them out.
Okay.
But if I had geographical ties to the program, if I had shadowed somebody in the program, if I knew somebody in the program, or if that program took candidates of my profile, even remotely similar to my profile, I would put in an application.
Right, right. How about, so like any of your like friends or colleagues from med school, were they also able to help you out? I don't know, get
yes, big time. So I reached out to everybody I knew.
Very nice.
And a lot of times we hesitate in doing that. The reason for our hesitation is because we are not part of this system. All our life, like in my country at least, the way I got into med school was to write my board's exam, and based on my merit, I got an admission. So we never have the habit of putting ourselves out.
Right.
Here, the one thing I did, if I knew somebody, I would reach out to them. And more often than not, people will not be in a position to help you, and they would say no. So we don't have to take that no in a negative way. It's just because the person is just not in a position to help me out. But if I reach out to 10 people, I would say one person was in a position to help me out, and it did. A lot of people went out of their way to help me in one way or another. So yes, my seniors, not just my seniors, I went on the website of my father's school. My father studied in Sainik School, Balachari, which is a very reputed institute in India. So his school had an alumni directory. I would reach out to everybody who's a doctor in that directory. And I would just call them and just say, hey, this is my profile, I'm applying, and if there's any support you could provide to my application, I would be very grateful. So yeah, just talk to people.
Amazing. Yeah, because, a lot of times, I think that's what sets one's application apart is this networking, so like a personal, like an email or a call from someone the program director knows, either attendings or even like friends, family. I think it does play a lot of role. I think we sometimes underestimate thinking that, our application will speak for itself, but the networking is key. And I'm glad you were able to get a very robust, like alumni to reach out to and make connections.
Yes, absolutely. I'm very grateful. We are living in an age of social media. This is a very strong weapon which is in our hand, and we have to make the most of it. But again, I would like to emphasize that any recommendation can only help you to some extent. It is at the end of the day, it might help you to get your front foot in the door, but then it's up to your hard work, your CV, your profile that will eventually see you through. So one must not also be like completely reliant on it, which is a mistake people make. So I just thought I would bring that point out.
Absolutely. I mean, yes, you should be worth the recommendations. If someone is personally calling, I don't know, a friend or a doctor or so, your application should be great. And which clearly in your case was, with all the scores and past experience. You applied extensively, and I think it seems like what you're saying, you were more interested in programs, interested in programs that took international medical graduates. So that's a very good approach. And would you share, how many interviews you got?
So I received, I received 14 interviews, out of which I attended 13.
Okay.
So yes, I couldn't attend one. So 14.
Fantastic. And how did you line up these interviews? Was it like as they became available, or were you like, okay, I'm going to take like, I'm going to try out with some programs where I don't really want to go and then go for the ones where I really want to go? How did you, arrange?
So I believe every program is amazing. Every I give equal importance, equal reverence to every invitation I received. And I was very grateful. I was full of gratitude whenever I would receive a single email that, okay, somebody took the effort to go through my CV, somebody put their faith in me, and somebody want to spend the half their day with me. Yeah. I didn't use any strategy. I had no a lot of people do that, and I don't. For me, whatever was the first available date, I accepted. Because I had one thought, let's say if I do delay in taking a date, and what if multiple interviews pile up on single date, which actually did happen with me in 2 programs, but that was an unavoidable circumstance. So to answer your question in simple terms, I just chose the first or second available date, and I just got started.
Yeah. Because I understand it's a very short time for you to make that decision. Is that right?
It is. Yeah, I agree. A lot of times I would get a call. I would get a call during, I'm working in a hospital, and I would get a call that, hey, can you fly down tomorrow? We have a spot open. And when I got the first call, I said, because I always believe in thinking before I commit. And once I commit, I want to follow through. So I
Yes.
said, give me 5 minutes. There was a snowstorm that day. So I just wanted to check if the flight was available to fly in. So I took 5 minutes, and by the time I called back, the spot was gone.
Wow.
However, I don't regret it because I was again offered the same spot 2 to 3 weeks back because they did keep me on the wait list. But yeah, I didn't take much time. Like, you have to be on your toes,
Yes.
and you have to be in a yes consciousness. Whatever comes your way, just say yes. That was my attitude.
I hear you. I hear you. And let's talk about the interview process. So was it like a very traditional interview, like you meeting one-on-one with like a program director and a faculty member, or a couple of faculty members and maybe a chief resident? Is that how it was done?
Pretty much. It was pretty much similar across the programs.
Okay.
There would be one-on-one interaction.
Mhm.
There would be interaction with the program director, attending, residents. There would be a tour of the hospital.
Yes.
There would be a pre-interview dinner. So it was fun. And the pattern is pretty much similar across most of the programs I went to.
Mhm.
You will get a lot of time to be yourself, observe them, and they will get a lot of time to observe you. So it's very well designed, very well structured. I thoroughly enjoyed the whole interview trail.
Very nice. Anything about the interview that you remember, or that maybe was a surprise question, a question that you were not expecting, I guess?
So yeah, once the program director asked me, okay, what is one thing that surprised you about the program? And that is one thing I wasn't expected. So I just said I was very happily surprised to see an Xbox in your call room. So he started laughing and I started laughing, and then he said, yeah, we do have an Xbox, but we generally encourage the residents to make use of the free time in different ways. So it was fun. It was fun. Nothing stands out in particular.
Right. Very nice. At any place, did you ever have like, it's called like group interviews where maybe like 2 or 3 attendings are together interviewing you, or anything like that?
So surprisingly, no. I know that happens, but on one occasion I had 2 residents interviewing me at the same time, but that's it.
Okay.
Like, I never had more than one attending. As a panel, I never had a panel interview.
Mm-hmm.
And I haven't even heard most of my other friends or co-applicants experiencing this. But again, I just know so much.
I understand. Tell me about how did you prepare for the residency interviews?
So when I spoke to my mentor, one of the best advice I received was, your mirror is your best interview partner. So make use of the mirror, make use of computer. Like, now we have the ability to record ourselves, to see ourselves, how we are reacting. So that's another approach I used. Most of the questions are going to be similar. I would say 85% of the questions that were asked to me were very simple, very common. Tell me about yourself. Why do you want to do psychiatry? Why do you want to come to our program? So that's it. And the third thing was friends. Get hold of your friends, co-applicants, family, and just practice with them.
Okay. Very nice. And were there any, I don't know, like books or anything that stood out that helped you a lot, just so that others can also reach out?
Right. So the best resource I found was you.
Okay.
I'm very grateful to you. I did a lot of research, but the quality of synthesis you have done, the amount of work you have put to answer most of the questions, to compile the list of questions, especially your article or your video on how to write thank you notes. Mm-hmm. That was amazing. So I pretty much, like, you were my one-stop, like shopping center for all my queries related to how to prepare for the interview. So I'm extremely grateful to you. Thank you so much for doing what you have done.
Most welcome. No, that's very nice to hear. Did you ever have any like video interviews or interviews by like Zoom or Skype or anything like that?
Yes. I had one interview through Zoom. All the other interviews were in person. And that was also coincidentally the program I matched into, the Texas Tech University Permian Basin. And that is what appealed to me. One of the things that appealed to me most about the program is how they make use of technology, and that is something I connected with. So yeah, so one of my interviews was on Zoom.
So when you say one, I mean like one program, that is like everyone from the program director attending, so everyone interviewed you on Zoom?
So I was very impressed by the way they conducted their interview. And so the first interview, two people on the other side of the camera asking me questions over Zoom. And it was a very, very beautiful experience. Like I felt very excited doing it. And once then on the next stage, they invited us all for a meet and greet at the program. That was in person. So I would say it was a combination of Zoom interview and an in-person interaction.
Okay. So would you say the Zoom interview was kind of like a screening process?
I don't know. I never analyzed.
Right.
I don't think it was a screening.
Difficult to say.
It was an interview. And for me, I didn't analyze much. Okay.
And now when you went for that in-person meet and greet, did you have another round of interviews then, or they just wanted to like chat with you, have lunch or something like that with you?
So again, I was very impressed by the way the whole day was structured. They did not have an interview. They gave us an opportunity to us to know them better.
Okay.
They talked about the work which is happening at the program. They made sure that we get to meet everybody, starting from the program director to the people working in the program, people in the administration, people who are working as counselors, the residents. So it was a very beautiful experience. Like in a way, I felt that there's a very strong sense of community. So that allowed me to get to understand the program and the people in a better way. And that was one of the main reasons why I ranked that program very high, is because of the way they structured the interaction, which was unique and which was very welcoming.
So you did your interviews, did a lot of traveling, and then now it's time to make your rank order list. So, how did you come up with the rank order list? That is, what were your priorities? Again, was it like visas or location, or, how friendly they were to you, or, IMG, in the proportion of IMGs in that program? How did you decide that?
Yeah, so yes, you're right. Most of the people do keep these factors in consideration when making the rank order list. All the factors are important for me. I just intuitively went with my gut. For me, the only criteria was, I'm going to spend at least 4 years of my life in this place with these people. Am I going to go home at the end of the day with a smile?
Yes.
So if I felt that I'm going to be happy here, I went with it. Because ultimately at the end of the day, all the programs are brilliant. All the programs are amazing. And it's up to us. We have to actively seek out knowledge. We have to learn. Nothing can stop us from learning if we want to learn. But being happy is something more important to me than just a geographical region or, like being close to house. And the people matter. The people matter the most to me. If I had a feeling that there are nice people in this program, I would rank it high, no matter where it is or how it is.
Right. Very nice. And did you, and so of course, did you also reach out to the programs towards this period when they're making the rank order list? I don't know, sending, I'm going to use the word, another thank you letter, or hey, I'm going to be ranking you high or something like that?
I did. So I believe people refer to it as a letter of interest or
Yes.
the love letter. So I didn't write a whole letter. I wrote a very small thank you card.
Okay.
And that's it. Yeah, I didn't put a lot of thought process into it, but I did let the programs know that that I would love to be here.
Okay. All right. But you didn't write anything like, hey, I'm going to rank you high or rank you number one. Is that something that you'd also disclose to the programs, or you chose not to?
No, I don't think, it did not appeal to me
Yeah,
intuitively. I don't know why.
absolutely. Yeah.
Yeah, I just didn't feel very strongly to say somebody that, because, no, I didn't do that. Sorry.
So that's perfectly fine, and that's also approach. That's an approach that I kind of discourage. You know, I mean, certainly if there's a program, you know, you're going to match them as number one. There's still, you know, and that's something you want to tell the program at that time. There still might be it might be a little bit okay to do that, but then you can't go back on your, you know, on that commitment, if you want to say. It's not really commitment, but you can't go back on your word. Um, so yeah, I really think just, you know, keeping it plain and simple. Hey, thanks for interviewing me like so many months ago, and I'm very interested in the program, and just want to say thank you, and just that's it, you know, and just end it there. I think that's good enough too.
I just like, if the program is going to rank me, he's going to rank me.
Absolutely.
That's it. A letter, I don't think it was good. Like after looking at my entire life story on a CV, after spending 2 days with me, I think that's it. They know, and they're psychiatrists. They are experienced.
Yep.
They are wise people. It's best just to keep things simple and honest.
Absolutely fantastic. No, very congratulations on you know, getting into the residency position. What do you plan to do after your residency?
So I haven't thought much.
Okay.
Like I said, I like to take one thing at a time. So I want to make the most of the resources available to me to come out as a good psychiatrist, to learn more from the people around me. One particular idea that appeals to me is we are living in an era of technology. So I want to learn how I can make use of the technology available to me to make sure that the access to mental health, the access to psychiatry is made available to people in the most remote places.
Mm-hmm.
And another aspect I would like to work upon is the aspect of preventive psychiatry. It's definitely a privilege when somebody with mental health issue comes to you and we can help them. But can we do something more to prevent the mental health diseases at the ground root level? That's where I believe my past experience of working in public health, my skill set of data analysis, and my training in psychiatry would help me build something on these lines.
Could you now, certainly, you know, your interest in psychiatry, it came, you know, after med school graduation, like you said, you know, you did a residency. Is that true? Yeah.
So no, I was interested in psychiatry from the second year of my medical school.
Okay, very nice.
It just was like, do I want to work in public health? Because that's where I believe we could make a very big impact on the masses. Or do I want to practice core psychiatry? So I did not have that clarity. Mm-hmm. So my first choice was to build a foundation in public health, preventive medicine, preventive psychiatry, and then jump into the core clinical competency. Because if I went into the core clinical competency first, I might not be able to develop myself. So I took the pyramid approach. I took the one which would help me have a stronger foundation. And that for me was public health, for me was preventive psychiatry. Once I had that foundation, I built upon it from my MPH and my research. And once I was confident of my ability, I believe I had a good perspective, a bigger picture in mind. That's when I decided, okay, now I should focus on developing my clinical skills. Again, a lot of decisions were very intuitive, not conventional, but I think they worked out.
It did amazingly well. Yeah, so you should be very proud of your achievements, and congrats again on a very exciting journey, and all the very best to you, Dr. Chaudhari, as you move forward in your career.
No, thank you, Dr. Aaron. Once again, I'm extremely grateful to your page, whatever work you are doing. It's I don't know if you realize it or not, but every small thing you post, every small comment you make has the power to transform someone's career. Something might click with somebody, and so just I'm very happy you gave me the opportunity to share my experience. You took out time to talk to me. I'm very grateful, and thank you so much.
That's amazing. Now, thank you again, and all the very best to you.
Thank you. Thank you so much.